Welcome to Butler News. This morning we are discussing a very important matter, a very essential concept that is modern in application. It is not very much available in most of our households and our institutions, but it's a very important concept that we need to have a conversation about. We want to discuss the idea of counseling and specifically mental health issues. In our studio this morning, we are privileged to have an expert, someone who has taken his interest and time and energy, and he has the passion to provide this kind of service. So we have Mr. Omar in our studio today, and we want to share so much about mental health. Mental issues are affecting almost everyone, although we have not taken so much interest in understanding what it is. So we will begin by giving him the chance to introduce himself further so that we may have to know who he is and what he does, so that after that we will move to the next question.
Thank you very much, Butler News. I'm Omar Chebi Chikombe. Omar is married to one wife with 4 children. I'm a counseling psychologist. I've also trained as a nurse, a sign language interpreter. My passion is counseling, of course, mental health. And so today we are privileged to discuss issues to do with mental health, and so that we can understand exactly what is it and how do we handle people in our midst who have some mental challenges.
Omar, we move quickly to the first question. We just want to understand, and you should help us to understand, and our viewers too. What do we mean by mental health? What is the meaning of mental health? What is it? Please let us understand this, because as we said earlier during our introduction, this is a very important concept, but it has escaped the attention of most of us because we have never interacted with this kind of thing. In fact, we have a lot of assumption and myths surrounding mental health. There are people who think that mental health simply means someone being mad or being insane. So please let us understand the meaning according to the experts. What does mental health mean?
I'll start by saying, when you move around in our towns or urban centers, we always meet people with some mental challenges. So being or having mental challenges is always stigmatized in our community. That is why, as mental health experts, we have taken time to understand exactly what is it, and that is what we are going to discuss today. So, to answer your question, mental health is the emotional, psychological, and social well-being. Mental health affects us, how we think, feel, act, manage our stress, and how we connect with others. If I can break it down, when we discuss emotional well-being, we are talking about how do we handle our emotions, how do we manage and regulate our emotions in different circumstances. Let us say, for example, when your son has passed exams, you will always feel good. Unlike when you have lost a loved one for death, you will always be sad. Now, when we discuss emotional health, we mean when you are emotionally drained, automatically you will be sad. So Mental health will help you understand that circumstances will always differ. So we have to work on how emotions are supposed to be regulated, because staying sad throughout can eventually lead you to depression. So as experts, we discuss and normalize your emotions so that you can live a purposeful life despite losing your loved one. Secondly, when I talk of psychological well-being, psychological, of course, psychology, the mind. Now, in terms of psychological well-being, it's the feeling happy, contentment, living with a purpose, with living with a purpose, and then the how our day-to-day interactions make us feel. Because at the end of the day, it will always rotate around how we think. Then lastly, on social well-being is how we form uh, health health relationships, forming and maintaining health relationships. Of course, health, we are talking of how do we relate with our workmates, how do we relate with our family members, how do we relate with even our enemies. Because at the end of the day, we will always engage. Socially, we mean relationship. We have to make sure, despite all the challenges, that they should be healthy. So basically, that's what we call mental health.
In from the experts standpoint or experts understanding, that's what mental health is about. I realize, as you say, that it has a combination of many facets. You talk about the psychological well-being, you talk about the social well-being. How is mental wealth different? I mean, mental health different from the physical health, because we are brought up in a society that understands that when one is sick or one feels pain in the body, one seeks services in a hospital. How is mental health different from the normal physical health?
Unlike mental health, which involves emotional, psychological, and social well being, physical health means the overall functioning of our body, how our cells, organs, and systems perform our day to day activities so that our body can perform its duties. Physical health is supported by one, we discuss nutrition, how we feed, the food we eat. We talk of enough sleep. We talk of enough sleep. Then three, we encourage people to do exercises. That's the part of prevention of diseases. So physical health is simply the well functioning of the body, supported by nutrition, sleep, exercises, and disease prevention.
We can understand actually the difference between mental health and physical health. And maybe the next concern, now that you are an expert in this area, just for the purposes of further understanding, uh, when do we know that someone is mentally stable, uh, and what are some of the maybe different classes of mental deviations? How do you group this kind of people? For example, under physical health, we have so many diseases and they can be classified. We understand this because now it has become like general public knowledge. Mental health is something very new, so maybe we still don't know how, whether these people are classified or it's just a unitary kind of challenge?
When do we know that this somebody is mentally stable? One, in terms of productivity, is this person productive to the community? If you are a teacher, are you giving your best? Two, we talk about how do you relate with others? Are you a social misfit in the community? Three, your self-care and grooming. Those three things are very important for someone to say that this person is mentally stable. Then on classification, we have different types of mental challenges, of which I'll mention a few. The first mental challenge is schizophrenia. When we talk of schizophrenia, basically we are saying this is a person who has lost touch with reality. So in short, we are talking of psychosis. Losing touch with reality means, one, you have a disorganized thinking, disorganized speech. Then we also talk of hallucinations. When we talk of hallucinations go hand in hand with our emotion, with our senses. We have a visual hallucination where an individual will always say that he's seeing people. When we talk of audio hallucination, a person will always claim that he is of course visual, he will see. Audio, he will hear. He will claim that he is hearing some sounds of which a normal person will not be in a position to see those people. Then we also have the sense of touch. We also have the sense of taste and sense of smelling. In terms of smelling, we call it olfactory hallucination. This person will always say that people are complaining that he or she is smelling, according to him. Then we have the skin. So you'll always hear somebody is assuming that insects are moving all over his body. So this person, hallucination go hand in hand with all our 5 types of senses. Then apart from hallucination, we talk of delusions, false belief. A person might claim that he or she is a king, is the head teacher, is the president, or we also have persecutory delusions where a person believes that he or she, people are after his life. He'll always say that people want to kill me. That's we call it persecutory delusions. So apart from hallucinations, disorganized thinking, persecutory, then your hallucinations, we also have bizarre behavior. Bizarre behavior means a normal person can be, you can meet somebody, a normal person, who has decided that one, he in terms of clothing, this is a person who has decided that clothes are not serving him well, so he walks naked. That's under normal circumstances, those are the bizarre behavior. Then like he can also either decide to, he might defile, to him defilement or rape appears normal. So those are behavior. Of course, deviant, we are talking of deviant behavior. So schizophrenia is a condition. Most of the time, these people you see around in town with the bizarre behavior, hoarding and everything, basically we'll always classify them schizophrenic. In terms of your schizophrenia, we have schizoform. Schizoform, that is 3 months to 6 months. basically. But after 6 months, it now qualifies to schizophrenia. Then on the same issue of schizophrenia, we have schizoaffective. Anytime you hear us discussing affective, we mean this person has hallucinations, disorganized thinking, and the mood is low. So affective means we are talking of the mood. So this is a person, he can show signs of negative behavior, negative symptoms of schizophrenia. This person will always be quiet, withdrawn, and sad. That means that is schizoaffective. Then apart from schizophrenia, we also have MDD, major depressive disorder, persistence, low mood, which could be caused by either loss of a loved one, loss of a job, divorce, can always lead to major depressive disorder. Of course, some of these conditions are also genetic, whereby you can inherit from your either your dad or your great grandparents. Apart from MDD, we also have bipolar mood disorder. Bipolar mood disorder is where we have two extremes. We talk of maniac. This person is hyperactive, very talkative, moving from one place to another. Then all of a sudden, the person becomes very quiet, sad, and withdrawn. Those are, we are talking of two extremes, hyper and so apart from now, of course, we have discussed schizophrenia, MDD, bipolar. Then kuna anxiety, persistent fear and worry. Of course, it is normal to have anxiety because at the end of the day, when you are preparing to do exams, you will always have what? Anxiety. But if it persists, that it is making you to become non-productive, that is an issue that needs now a professional intervention. We also have SUD, substance use disorder. And as anytime we say a disorder, that means this thing has destroyed your productivity. So substance use disorder is a situation where a person uses multiple substances. We can discuss bang, cigarette, alcohol, heroin, and everything. So substance, that means that is a group use disorder. By using this substances, it makes this person useless. He cannot be productive in terms of interaction and everything. He will always be like a burden to the society. Then we have AUD, alcohol use disorder, of which basically in our area, this is a situation that is very rampant. We have people who use alcohol throughout. In alcohol, a person will start like experience, we call it what? Stages of addiction before somebody qualifies to be an alcohol disorderly person. First, this person will always come like experiment. You are using alcohol, I accompany you to a pub, you tell me, Omar, today I want us to just try. That's the first step. Then regular, I can be using alcohol, but it has not affected my productivity. Of course, you can see there are people in the villages, they take alcohol over the weekend. They are productive, but that level we call it regular use. Then the next step, we move to risk. You use alcohol, that now becomes a risk to yourself and a risk to the community. We always give example of these young men who ride border with all due respect. Most of them use alcohol or other drugs. That's why the accident, if you visit some of these hospitals, most of these accidents are a result of risk use of alcohol. Then we talk of dependence. These are person, of course, they always joke that lazima nitoe loko. You cannot function minus that alcohol in your blood system. Then lastly, we talk of addiction. Addiction basically now becomes a mental issue. That's why it is always very hard to struggle for somebody who is addicted with alcohol just to cease, as we always imagine. It needs thorough professional intervention. So basically, I've mentioned around four to five conditions of mental challenges in our community.
When do I know, or when does one realize that one has a mental challenge or a mental disorder? It's easy for someone to know when they are sick in the body, what we are calling physical health. It's very easy. When you feel some pain in any part of your body, you will simply know that at least you need to seek for medication. How about this mental health thing? When do I know that I need to seek for mental health restructuring service? Because according to the way you have explained it, it doesn't cause pain to me. Maybe it affects my productivity, and I may not be in a position to even know that my productivity has been impaired.
In our community, we have a role to play in identifying people who are suffering from mental challenges. So it's a very valid question. At our community level, an individual who is productive will always have enough sleep. It is normal to lack appetite, but if it persists for over 2 weeks, then we are talking of something that is becoming a big issue. So how do we know that as an individual, I'm beginning to be mentally challenged? One, we will always have insomnia. We will struggle to sleep, and to some extent, the whole night you might not have sleep. Of course, at our age, we are supposed to sleep 7 to 8 hours. But if you are sleeping for like 1 hour or 2 hours, that becomes an alarm. Two, we are talking of appetite. Because of day-to-day interaction, we will always have some, your appetites will always fluctuate. But if it goes to an extent that almost every day you lack that appetite, then it becomes an indicator there's something wrong. Three, we talk of irritability. You can find even yourself, your child or your partner just jokes, and you become very hard on her, simply because you cannot manage your emotions. Then four, in terms of production, as a teacher or somebody who works, you will always feel like you are now overwhelmed. Something you used to do very well, it's now you are struggling to achieve your targets. So basically, if those four indicators are manifesting, then there is an issue that is cropping up. So at community level, you can diagnose at that level.
If I feel sick in my body, I will just walk to the nearest dispensary or go to the hospital and get this thing fixed. After discovering or realizing that we have a mental health crisis, what happens? Where do I go to in order for me or my loved one to have this thing fixed? Because seemingly this is a new conversation, and because it's a new conversation, most of us have not yet interacted with the way out of this kind of situation. So we could be having a lot of challenges in the community, but we really don't know where do we go to seek for service. Where do we find help so that we are stabilized and we become much more productive, as you mentioned.
We appreciate this a new concept, but we also thank God that we have experts, because you are speaking to one. So we have counseling services online. We call it telecounseling. We have physical offices, let us say like in Butula, we have like 2 to 3 counselors. You will always get assistance whenever you need it. Then at the community level, we are also trying as much as possible to sensitize the community. We engage with schools, we engage with churches, we engage with mosques, so that at least everybody is brought on board, so that to understand that once our loved one has mental challenge, he or she can always get assistance. Then at the community level, before you even think of visiting a counselor, probably this is a person who just needs to be listened to. So the community also has a role to be empathetic. Be ready to listen to your loved one. What could be going? Because some of these people might only need just to be listened to, and he or she might stabilize. But the greatest challenge of our current society, people are busy. We have people who are there to listen to others are very few, because everybody is rushing, looking for his or her survival. So at family level, form family meetings, endeavor to know what your family member is going through. In fact, on the same, like in any other field, we have quacks. We have a counseling and psychology board, a registered body that regulates counselors. It is also wise to understand that this therapist or the trained personnel you are that needs to handle you, how far is he trained? It is your right to understand the nature of his training, so that it gives you that confidence that I'm being handled by an expert.
Why do we need counseling services? Why should we have counseling services? Do you validate the purpose for counseling? Does it add value to the community, to the people? Why do we need it?
The first importance of counseling will facilitate productivity and learning for students. Because let me give an example of a child who is stressed. Do you expect that child to go to school and perform? And to some extent, the child might be stressed because of the school work. So as much as we are pushing him to study, the child is stressed. So with provision of counseling services, this child will be able to solve his or her own issues and become good in class. For employed people, a person who is emotionally trained, in terms of production, he will not produce. So counseling services will enhance good classwork and productivity. 2, counseling will always give you an opportunity to live a quality life. That means if you lost a loved one, you will work with the counselor so that you come back to your normal world. People have been retrenched. People have lost jobs. So as a counselor will come in that situation to help you adapt, so that you despite that loss, that your quality life is maintained. 3, counseling will also enhance relationships. People, the first cause of conflict is relationship. So long as you are in a relationship, whether you are married, you are child, and you are co-workers, you will always conflict. So what does counseling do? It always comes in for conflict resolution. That means you will always coexist well. Then the fourth thing, we talk of resilience. At times, let us say like we are approaching election period. We are people who are going to lose. We are people who are going to be harmed. So counseling will always give you an opportunity to bounce back, especially after losing. Of course, people will lose money, people will lose status. So that resilience and bouncing back will always come because of interacting with therapists.
Now, back to the question of mental health. Who is affected? Is everybody in the community affected? Does it affect someone according to age? Who is this that is affected? The old, the young, the middle age, the working class, the non-working class, the poor or the rich? Who is affected with the issues of mental health?
That is a very good question. Because there is always this misconception that the weak people will always be affected. Unlike they believe, everybody, let me be very clear, everybody is affected. From the child to the oldest. Of course, when you are old, you have the old age challenges. And if you are young, maybe your mother or your parents have separated, it will always come with, it will always affect the young ones. Now, it does not matter the status, the rich, the poor, the believer, and the non-believer. All people are affected by the mental health challenges. And why are they affected? One, it might be genetic. As I said, maybe in the family line we have depression, so it will always affect the offsprings. So long as you come from that family, you will always be affected. We are not saying all, but there is a possibility. Then the environment, everything we do, accidents, loss of a job, loss of of course, divorce. So whether you have money, if you lose a loved one, you will always be affected. To even church members, being saved does not exclude you from having mental challenges. Then thirdly, we talk of psychological, like trauma, accident, losing a limb. You are used to using your right hand in writing. So I want you to imagine, once you lose that limb, it becomes a very big issue. In fact, you'll even find like you might not even be comfortable interacting with the people, because people are used to seeing you with both limbs. So let us emphasize that everybody, regardless of the status, regardless of your religion, regardless of age, will be affected by the mental health challenge.
I realize from this discussion, from this conversation we are having, that mental health actually is a very important area, like we said it from the start. Maybe my next question would be, because we have an expert with us, he should lead us into understanding how do I avoid or minimize the chances of myself plunging into a mental crisis or getting into mental deviation. What am I supposed to do? What should I do? For example, in the physical health area, they would like say exercise, eat well, and all that. How about this mental health? What do we do?
Just like in physical health, in mental health, we encourage people to eat a balanced diet, do exercise, connect with others. Connecting with others means it is your duty to ensure that you call or visit your people. Set achievable goals. Because sometimes we put ourselves under a lot of pressure by setting like a very unrealistic unrealistic goals. Have enough sleep. Avoid excessive alcohol or substance intake. Talk to your loved one in case you feel you are down. Then, lastly, if you feel that all is not well, I always encourage people, always shout. People will not assume that people will not see that you have a problem. It is you to understand that I have an issue. Speak out. I'm encouraging everybody to shout. If you have an issue, shout. Because basically we can start just by counseling. Then we have psychotherapy before we move to drugs. And by the time we move to psychotherapy, we'll have introduced what? Drugs. So at this initial level, if we can handle it at initial level, the better.
We have been general, actually just trying to look at the general understanding of mental health and the need for counseling. In future, we will move to specifics. But maybe just before we close this discussion today, we want to ask our visitor, Mr. Omar, as an expert in this area, to just put to us just one closing statement on the discussion we have had and the future of counseling and mental health in this country in specific and maybe the world in general.
I want to say the following. All trained personnel or trained human beings are there to serve humanity. So I'm calling upon everybody, especially church leaders, imams, let us work hand in hand. We need to complement each other. We are not competitors. We are just adding value to your spiritual work. So let us be sharing notes. Where you feel you have a gap, a psychologist will always come. And where a psychologist feels there is a gap, because there are issues that need religion intervention. So we are also encouraging the general population to keep on sensitizing issues to do with mental health. Then lastly, this element of stigmatization. Why do people fear discussing about mental health? Basically, it is because of pride or ego. That feeling that I cannot be mentally challenged. Then the myth that the weak ones will always seek counseling services. It is not for the weak, it is for the strongest and those people who are confident with emotional intelligence. Because you will always understand that I have a gap. I'm not well resourced to handle this issue. Then, lastly, on the issue of stigmatization, let the community understand that mental health, it is not about being bewitched. We have a solution, we have drugs, we have experts, our people can be helped, and they'll always become productive in this country. Thank you very much.
Thank you so much, my brother Omar, for we actually have had a rare chance of having you in this studio today, and we want to thank you so much for sparing your time to bring us close to the understanding of this very important area, this important topic. We just want to pray that we continue having this kind of discussions, and as it goes out there to the masses, it will definitely impact and change the attitude of our people. So we want to welcome you one more time when you have a chance, so that we may get deeper into the concept of mental health and the need for counseling in our society, because we believe that if we do this, we will heal our society, and then increase our productivity as a community, and then we will live according to the design of God. So thank you for so much, and welcome.